How do substitutions affect speech sound articulation? Imagine trying to say a word but hearing a different sound instead. That's what happens when substitutions occur in speech. They can make words sound different from what we intend. When someone replaces one sound with another, it can change the clarity of their speech. For example, a child might say wabbit instead of rabbit. Here, the R sound is replaced with a W sound. This kind of substitution can make it harder for others to understand what they are saying. In speech sound and motor disorders, substitutions are a common type of error. Alongside leaving out sounds, distorting sounds, or adding extra sounds, substitutions change how a word sounds. They affect the way the mouth, tongue, lips, and palate produce sounds. When a sound is replaced, the movement of these parts is different from what it should be. This can lead to speech that is less clear, especially if substitutions happen often or involve important sounds and words. Speech pathologists see substitutions often in children with developmental speech issues. They notice patterns like fronting, where a back sound is replaced with a front sound. For example, saying te instead of ki. Or backing, where a front sound is replaced with a back sound like gog for dog. Another common pattern is gliding, where L or R sounds are replaced with W or Y, such as wug instead of rug. These patterns are normal at first but should go away as a child grows. If they stick around past the usual age, it might mean therapy is needed. Substitutions can make speech less understandable. When sounds are replaced, listeners might misunderstand the message. This can affect social interactions and learning. They also change the usual sound patterns of words, which can cause confusion. If these patterns last too long, they can interfere with learning correct speech sounds and rules. Speech therapy helps address substitutions by teaching individuals to hear the difference between the correct and substituted sounds. Therapists often use minimal pairs, which are pairs of words that only differ by one sound, to practice correct pronunciation. For example, practicing ki and ti helps distinguish the sounds. Therapy can also focus on strengthening the muscles needed to produce the right sounds or improving awareness of sound differences. Early intervention is key to improving speech clarity and communication. In summary, substitutions change what we hear by replacing intended sounds with incorrect ones. This can make speech harder to understand and affect communication. Speech therapy helps correct these errors, leading to clearer speech and better interaction. Recognizing and treating substitution errors early can make a big difference in developing confident speaking skills.